When I was 18, I would have multiple seizures a day, and I didn't have health insurance. And so I would just, after having an aura or even a seizure, I would just go into the bathroom and lay on the floor all day, because having seizures makes me very nauseous. So I would just sleep in the bathroom for days at a time after having multiple seizures. I'm talking about up to 18 in one day. So I decided that I needed to do something about this. I went to the emergency room, and then I made an appointment with my neurologist here in Concord. And I told her that I need to do something about this, besides taking my anticonvulsant medications. So she referred me up to Dartmouth Hitchcock in Lebanon, and that's where I met Dr. Jobst and her colleagues. And after trying more than 2 anticonvulsant drugs, and to no avail, that's when I became a candidate, so to speak, for the NeuroPace study. After I have a seizure, I sleep for good time afterward, and it affects my memory so bad that I can't even remember what I did 2 days ago. So just trying to do things with my daughter or my family and not having a memory that's the worst part for me. I have a very supportive family, so I'm with somebody other than my daughter all the time. I live with my sister and her family, and if I have a seizure, they'll take care of me and my daughter for me while I'm sleeping for the next 2 days. But it's really hard, especially when my daughter witnesses a seizure. It terrifies her. First of all, I had a surgery in April of 2007, and that was the intracranial study where they would put electrodes on my brain to find out where the seizures were emanating from, and I was in the hospital for a good 2 weeks. Then once they found out where they were coming from, I was eligible for the NeuroPace study, and what that is it's a small device, probably the size of maybe 2 inches. And it's a small device that has probes coming from it, 4 probes. They put the probes into the brain, and then they remove a piece of the cranium and put the NeuroPace transmitter in place of the cranium, and they put the probes into the brain, and then they turn on, for me they turned on 2, and then what it does is it'll track your brain electricity, and then the probes will kind of send out shocks or electricity stimulus, and to kind of cancel out the seizure. And the study is, because it's not FDA approved yet, I have to download, and what that is they sent me home a laptop, and it's from NeuroPace study, and the laptop has a wand from it that I have to put in place, hold it there for a couple seconds to get the quality and signal of the transmitter. And once the quality and signal's up enough, I hit OK, then I analyze the data, then I send it through the phone line to, I think, California, and they're able to determine that it holds up to 24 hours of information. So they can see 24 hours of brain activity. I go up to Dartmouth every 3 months, and they do the downloading there as well. All I have to do for them to adjust the probes is just lie on the bed and wait, and they're able to do it through their computer system. When they turned the first 2 probes on, there was a difference from having multiple seizures in a day to having 5 or less in a month. And then when they turned on the other 2 probes, so that all 4 of them are on, I haven't had any seizures in a month. Being part of the study, not only helps me, but I also think of other people that have epilepsy or who have children with epilepsy. And this is another alternative for those people to try to not have any seizures at all. First, I was reluctant to have the surgery done because it just, when you think of brain surgery, it scares somebody. It would scare you. But I was also excited because I'm very fascinated with the human body, and I actually wanted to be a neurosurgeon myself. Dr. Jobst is a wonderful doctor. She's very professional, but she can also be very sympathetic and friendly. She's just absolutely wonderful doctor. I'm a student now at Hesser College, and before I wouldn't even think about it, just because of I would never know when I would have a seizure. And I'm on disability also, and I want a job. I want to work. I want to do something, but I can't work because I never know when I'm going to have a seizure. But now I'm in school, and I'm confident that this is going to help me do something. I do a lot with my daughter. I do as much as I can with her because, one, I love her, but also where she's at risk for having neural tube defects, I want to make sure that she has the best quality of life and is able to do everything that I couldn't do before the transmitter was put in place.